So recently, the clinic here made the decision to no longer bulk bill patients who are coming in under team care arrangements or chronic disease management plans. The reason for this is purely it was no longer economical to do so. To see a patient and bulk bill them, basically we ran at a loss. To give you an idea of what is involved and the costs associated with it, a patient who comes in with complex needs often has two or more items that need to be assessed, two or more injuries, two or more conditions. As an example, iCare, workers' comp, for a 1 hour consultation for a client with two or more conditions would pay about $198. A follow-up consultation is about $132. If you have a client come in under the NDIS, again, initial consultation, if you're taking an hour, that's about $194. And a follow-up consultation, you're probably looking at about $140. Medicare views an initial consultation as a 20-minute item, which is utterly ridiculous for this class of clients with multiple and complex needs. They also only value that consultation at $68.55, and that is on which they base their rebate of $58.30. So basically it could take us an hour consultation as well as writing a letter back to the doctor for $58.30 remuneration. I'm not sure what other professional is going to work for $58 an hour. Unfortunately, that is where Medicare values allied health professionals. $58 an hour does not make the bottom line work. It is a half to a third of what our services are valued at by other companies, by other services. It's also great reflects what we need to actually make the business profit and keep the business alive. So unfortunately, it is not possible to see these clients and bulk bill them. We realize things are difficult, but unfortunately, we're not here to run at a loss. We cannot continue to devalue our services that much to give this to clients. The only solution to this is that Medicare has to revisit the rebates they pay under team care arrangements and realize that the idea that an initial consultation is only 20 minutes is absurd and out of touch with reality, and that the rebates they're given are totally out of touch and not in line with other compensable services such as work cover and NDIS. Until Medicare ups its rebate, ups its scheduled fee, and comes to a bit of reality of what allied health professions are worth and what a consultation takes, what is involved in managing these clients, then bulk billing is going to be non-existent for these clients, and it is going to severely detriment your clients who cannot access services or cannot afford to access services because they're not available. Yes, it is health, and there are many reasons that people say we should be helping people out. Bottom line is, we are a private business and we're here to make money. If we don't make money, we go bust and we go it alone. Your other line may be that the costs are too high. Well, probably you're paying, like my mechanic to come and fix my washing machine was $144 an hour. It was $90 for the mechanic to turn up. My car mechanic is over $100 an hour. These are the costs for everyday things that people don't seem to have a quibble with. But when it comes to their health, they don't want to pay. They want it for free. They do not budget for health care. Unfortunately, this is the cost, and this is the modern day reality that healthcare is your responsibility and it is going to be a service you have to pay for. There used to be a free service provided by the government at hospitals and community health centres. Unfortunately, these have mostly disappeared, and these were the viable options for people who could not afford to pay for a private service. Unfortunately, the current situation is that physiotherapy services are being left to the private sector to cover, and unfortunately the private sector is not a benevolent service and it cannot afford to give away free or uneconomical products because the service will not be able to keep going. So have a think about this next time you're complaining that you have to pay a gap fee or you have to pay a fee to see your allied health practitioner. The government and successive governments over a number of years have chosen not to fund these services to an appropriate level. And now the practical result is the service is not available to you, or you have to put your hand into your pocket. I also think people need to rethink the reality of healthcare and that it is not all free. Medicare does reimburse some services, but it is not a universal free service. It is terrible to think that you can get some services through Medicare, through a very medical line, and be basically not needed to pay because they are free, but a service that may keep you out of hospital, may keep you from having to have surgery, is limited to 5 visits a year and is terribly underfunded. So that's the current situation, and unfortunately that's our explanation of why we're no longer able to bulk bill. It's simply no longer economical viable to do so, purely through government decisions and being out of touch with reality.